pass the baton to Mr. Sharif, who can potentially give us more insights on how the futuristic technologies are shaping up healthcare and what are his views on how these futuristic technologies are going to, interact together to help battle this particular crisis that we have, and potentially post-crisis, how this is going to really shape up the overall ecosystem.
Am I audible?
Yeah.
I mean, there was a very small statement. Now, post-COVID and after that. And we've got little time to do it, and let me see how I can cover that. Arun, if I can request you to share the...
Yes.
Mr. Shariff, your audio is a little feeble, though we can hear, but looks like as if you're talking from a distance.
Okay. Is this fine now? Is this
better?
Better. Yeah, it's better.
Okay.
But yeah.
Okay. So thank you, gentlemen, and especially I really enjoyed the first part of the panel because a lot of doctors and they were giving all the terminologies which I really couldn't understand. But there was a lot of learning there.
Sorry, Mr. Shriv, but we're losing you again. I mean, at least I am losing you again. Your audio is pretty feeble.
You're right. It's pretty feeble. Yeah.
Just give me a second. Let me try using a headphone. Just give me a second.
Is this better now?
Yeah.
Definitely.
All right.
And Shariff,
Okay, so yeah. Sorry?
I've given you a control. You can run the slides by...
Oh, that's wonderful. Okay. Let me see.
You must have got a request, yes.
Yeah, okay. Because I'm going to use the mouse pad, it's going to like run. Let me try. Now, I think, Arun.
I'll do that. Okay. Now it's in...
Wait. Can you see my screen?
It's loading.
Yes, but it's blank.
Okay. Arun, why don't you take over and just I'll say next slide, help me with that.
Sure.
Okay. Can you share it? Yeah. All right. Thanks, Arun. Okay, so when I was told to talk about healthcare and IT, I was wondering, when did all start? When did healthcare start and when did IT start? So I just did a little research. Conventional medicine started from 600 BC, and IT as abacus started from 500 BC. So that's something. You can go to the next slide. That's something is too long for us to find out, how we're going to do it. So then I thought, what is the next closest thing that healthcare and IT can be partners? So the next slide talks about it. That's something that we have in common. The next slide, Arun. Yeah, something that we have in common at this point in time is the virus. Both healthcare and IT, both of us, struggle with the virus that we actually have. So, that's where we are partners there. If this was a forum where, we were, in a real room, I would have asked the next question. Next slide. Just about a few months back, I heard about this word, WFH. I was like wondering, what is this WFH? And, it started with work from home, but it really ended with work for home. And I guess, that's what most of us are doing here. So in the similar line, I was also thinking, if you go back long back, when we were students and listening to our studies, this is the image that comes to us. Next slide, please. Evolution of humans. this is in the biology book. I remember this, and how we grew up, how the human race grew up. Okay, but if you have to ask people now, how is the evolution, and that's where the next slide is about. This is what we are right now. It all started with mainframes, and that's how IBM became more popular. And then came the desktops with Microsoft getting much more popular. And then came laptops, with Dell and HPs becoming there. Then your Apple picked up with all the mobility and things like that. So, the evolution in terms of how humans have evolved, how IT has evolved. And this is more to do with the hardware part of it, but let's look at the software. And then this is a slide where most of us, and especially the last speaker, spent a lot of time on that. So I'm just not going to do it, but he's explained extremely well in what I wanted to share. That most of our, and this is true not only for healthcare, but for any domain, that we all start with an ERP. And once the ERP, we get into, and in healthcare, he spoke about the electronic health records, the patient-doctor scheduling modules, HR, payroll, finance, supply chain, everything comes under that. Then he also touched on the e-commerce, the payment that we need to do, and things like that. Right now, where we are is more of a self-service. Today with a lot of technology companies coming in, you don't have to actually go wait and in the reception to get your registration done. You can use a kiosk, you can use a mobile phone to do your registration. You don't have to actually go back to the labs to go and collect your reports. It comes on your messages, emails. So self-services come in. And very, very importantly, he said he's implemented RPA, which is the robotic process automation. I've actually seen it. One of the use cases where if you have to get discharged from a hospital, you see a doctor giving you a summary. After that, you run to the lab to get a no objection. Then you run to the accounts department, and then you run into multiple pharmacy to ensure that all these things are got placed. But they are all same systems lying in one particular location. Do they still work as silos? So robotic process automation comes in. You just have to create a bot there, and this bot is going to connect to multiple functions, multiple process. At the click of one button, it's going to help the organizations deliver things much better there. And AI, artificial intelligence, something that everyone talks about in industry, and I think that by itself it's a very large, huge topic. But at this point in time, let's keep it. AI at this point in time, for decision making is where most of the people are using it now. Next slide, please. In the next few minutes, what I would want to focus on is the healthcare software. There's a lot of difference between a medical software and a healthcare software, while the benefits are almost the same. A medical software is the one which focuses on the patient's medical state, and what we as IT people will generally do is on pertaining to patient care and experience. So that's where the most of the technology that we would be talking about in the next few minutes. Next slide, please. We'll call it the emerging technologies. Next slide. So whichever webinar we go or seminars, the first topic that everyone wants to know about is on AI, and how does AI contributes to whichever domain that is in. The market potential, the growth is extremely high. The type of parameters or the verticals that we can go look into the healthcare domain, what AI can come in is also extremely large. Having said that, the only point that I would want to make in this part of AI here is, for the AI industry to grow, we need, when I say we, the IT industry needs the support of the healthcare industry. This is one industry where both of them have to grow together. Without the knowledge, without the experience of healthcare people, AI cannot build algorithms on its own. So I would want to state here that AI in healthcare There's a long way to go, but it is healthcare and IT people have to work together, be in partnership to create multiple solutions, some of them which I've mentioned there on that. Next slide, please. The other one that's getting really excited here in our world, it's the IoT, which is Internet of Things. And in the healthcare world, it's called the Internet of Medical Things. I'll take an example in the IT world where the cars that are getting manufactured, they call the connected cars. You know, when a car gets crashed, or meets an accident, the car can actually send a message to the nearby healthcare industry, and an ambulance can come there. So the technology is already available, and the cars that is getting manufactured, especially the Ford and GM cars, do come with this technology already inbuilt. These are the connected cars. And shoes, the shoes which gets run are filled in with chips. And what it does is it also understands by the way you walk, by the way you run, the type of weight that you put, or the type of strain that you put on your legs. How are you actually dealing it? Are you putting the right effort on each leg and things like that? It collects a lot of data there. But interestingly, I would want to give some data points with respect to the medical devices. If in a hospital, there are multiple devices, medical devices there, which I've shared there. And all those connected medical devices, if you are able to use them, what it gives us 4 to 36 minutes of nursing time. That's the saving that you have. These are surveys, statistics done by large organizations. They say connected devices in the hospital saves a minimum of 4 to 36 minutes of nursing time. And it also prevents 24 data entry errors on a daily basis. So that's the power of Internet of Medical Things there. And not only that, the first speaker spoke about telehealth, and the doctors were also telling that even during pregnancy, how they can actually remotely monitor their patients and things like that. So that's where technology today is helping in terms of remote monitoring as well. Can I have the next slide, please? This is a very interesting slide because this is the power in our hands. We found a little mobile device in our hand, and this mobile device made us powerful in terms of making it digital, making us mobile, and collaborating with a lot more people there. And I wanted to share, in this particular case, Yoopha as such, and we saw the video there, has created a platform, and that's a collaborative platform where all the stakeholders in the healthcare industry, right from the patients to doctors to clinic to pharmacy, the lab, everyone comes under one platform. And this platform, what do? They allow us to do business. They allow us to increase our revenues by multiple ways. And based on all the analytics that this platform shares us, the efficiency also increases there. This is another technology, the mobile technology, which is helping the healthcare industry get better in efficiency, and as well as add more revenue to that. Next slide, please. I just want to touch on the various challenges that the healthcare industry would face with respect to technology and how we could help it. Mostly it's digitization, and I guess one of the first speakers spoke about rural versus urban hospitals. Digitization is something that India has picked up. Most of the electronic health records have come in, and by means of which there's a lot of data that has been created. But I would want to spend a little more time on a particular challenge that this industry faces. There's a myth which says that there's a lot of cyber attacks, and these cyber attacks happens in banks, financial institutions, possibly in government institutions. The data actually shows that close to about 5.5% of the attacks are on the banks. Education institution follows next with 7.6%. The government or military has about 11.8% of the attacks. Healthcare industry has 42.3% of the attacks there. The reason for that is more than 50% of the hospitals across do not have proper security features enabled within their systems there. And that is the reason why that these attacks are much higher. And another interesting point is, when a financial data is being stolen and sold, okay, basically the KYC, who's what, the address and date of birth and things like that, it's sold for 10 rupees per data. But a medical data is actually sold at 75 rupees per data. That is so important for people because you get more and more information on that there. So I guess the most important challenges in addition to the technology, but most of the healthcare industry faces today is on cybersecurity. And I think that's something that, IT helps them on do that. Next slide, please. Okay, so everyone has to talk about COVID-19. So I also thought, let me touch on COVID-19 and how is the technology actually helping COVID-19. So if you look at the stage, the first is the contact tracing. And this is where we use Bluetooth and data tracking technology. Once the patient has been tracked, in most countries here, we ask them to do self-triage tools, whereby, all the parameters are checked by himself. And until unless he's not serious, though he's found to be COVID-19 positive, he has to be within his premises. And that's where the telehealth comes in there, which is the Internet of Things comes in there. And you're able to see him that he's under quarantine. And the doctors are able to speak to him from a remote manner. And all this data is then given to the big data. And then, we see that the curve is going to get flattened by June in India, July in Middle East, August in US. These are all data that keeps, every day we get pushed into the AI system that has been built. And based on which a lot of decisions are being taken, how many kits needs to be procured, what type of infrastructure that needs to be done. So COVID-19 scenario, I think, is a great example where IT has been consistently helping the healthcare industry to overcome the challenges that it's facing now. Next slide, please. These are the Philips very recently sort of did a good survey, and I just wanted to share 2-3 pointers in that. 71% of the millennials today are so comfortable using a phone that they are happy to meet the doctors via phone. I guess Yoopha is on the right track there. 80% of the people are very comfortable using wearables, and these wearables give them the parameters that talks about the health parameters that talks about. So they're very, very happy to use that. And then the rest of things that we've already spoken about in terms of the telehealth and predictive analysis, these are the trends that is currently happening that's influencing the health in terms of the data and managing them. Next slide, please. So every industry has, version 1, version 2, version 3. Healthcare also has gone through these versions. Healthcare version 1 was more to do as a curative treatment. The health version 2 was more to preventive treatment. Healthcare 3, what we are all seeing here is not only preventive, but also alternate treatment. So I just wanted to dwell a little more on the future or how the alternate treatment is going to be. Next slide, please. So very interestingly, this is a combination of both medical software as well as healthcare software. So different countries, what are they focusing on? And in the next 5 years, what they want to do, in the next 25 years, what they want to do. So we sort of spoke about various things in terms of RPA, AI, and things like that. There's one interesting thing that I've noticed there, which is called the designer babies. And people are looking at designer babies to come in 25 years. But I don't know how many of you know that the first designer baby that was born is in the year 2000. And his name is Adam Nash. He was born to save his sister. A sister was suffering from a bone marrow and she wanted a bone marrow transplant. And so they created, they actually did this designer baby, and with the bone marrow that needs to be given, and both are living now healthy. She's now 23, and her name is Molly Nash, and Adam Nash is 20 years old now. So there's a lot of that's got to do with the medical part of it. So there's a lot of things that we need to look forward in that particular area. But then, if you actually see, there is much more from a technology perspective that what we can contribute to the future. The next slide, please. So one other important thing, that we all look into is the brain-computer interface. If you see that, you could see the brain, where both via invasive or non-invasive, you could get the pulses from the brain, and through that it is converted into signals, and these signals are then pushed onto a computer, and a smart home can be done. For example, in future, what we can do is, by my thinking, okay, I could actually switch on the light, switch off the light, which is already, trials are already happening there. More from a healthcare perspective, what we are seeing here is it helps people to fight paralysis. A lot of these robotic arms that are there, the wheelchairs, because of the handicapness, this BCI is helping them. Using their brain signals, they are helping them to control the robotic arms and wheelchairs. So these are great examples where the technology is actually partnering with healthcare to see how we can provide much more better care for the patients there. One other activity that we also see is the 3D printed organs. The next one, please. The data shows that only in United States, more than 100,000 patients, they wait for donors. Okay, and there's a lot of waiting time. Okay, if you see the picture, the colors mentioned there. The color which is mentioned are in green, which is your bone, the ear, and skin. They are already in production. You're getting 3D printed bone, 3D printed ears that can be used there. The ones that are mentioned, figured in orange, are the ones that are in clinical trial, which means that any point in time we'll be able to see 3D printed lungs, 3D printed kidney, 3D printed heart. These are things that are in place, and there are more and more work that is getting on in these activities there. So BCI and 3D printed organs are two technologies that I think would definitely help healthcare, help patients there. And back here in Dubai, we have seen artificial intelligence and BCI and 3D printed organs already being implemented in a lot of hospitals, and there are patients who actually been getting benefit out of it. Okay, so as people were saying, we get used to a lot of these new terminologies, which is called the new normal. So how I would see new normal, especially IT helping healthcare. So the lady out here, she's Miss Anne. She's 65 years old, and she's got a congestive heart failure and diabetes. But look at her daily, how she's gonna do the day when she gets up and she puts her feet on the floor. That's a Wi-Fi enabled floor mat that can find out the weight of her. She goes to brush, and there's a Wi-Fi or sensors in the bathroom mat. It senses for early signs of ulcers. She's got a patch in her arm. This patch will always keep checking for heart rate, BP, sugar, etc. And when she needs to take pills, the future pills will come with sensors that will give instruction or information to the patch and says that, hey, listen, I've been taken on time, I've been taken on right amount, and things like that. So her entire life is completely monitored by IT. And the beauty of that is, today, what IT or healthcare does is reactive. What tomorrow it does is proactive. In case Miss N gets into a problem, automatically the patch sends a message to the doctor and tells him these are the reasons why she's having a problem. Please, before she could get into an issue, come there. It could also send a message to the doctor and doctor. But what we are seeing here is what IT would do for healthcare is more than reactive. It's going to help us in proactive way of decision making. And that to me is the new normal. The next slide, please. This is just to, everyone makes a meme. So I was thinking, laughter keeps the doctor away is the old one. LOL, that's the computer way, is healthy. So true partners, IT and healthcare in every way. And my last message, because there was a lot of doctors that I've seen in the panel and things like that, I just wanted to read this to them. One machine can do the work of 50 ordinary men. No machine can do the work of one extraordinary man. And that extraordinary man today is a doctor. And to all the frontline caregivers, I thank you all.